Good morning, ladies and gentlemen. This is Acting Mayor Jim Walsh from the studios of WGET here in Gardner at Gardner High School. Today is Thursday, March 26th. It's just a little before noontime. I'm happy to provide an update to a couple of different important categories of response that we're providing here in the local level to the COVID-19 crisis that we're experiencing. Today, I have with me President and CEO Win Brown from Heywood Hospital and State Representative John Zlotnik, who will provide a legislative update for the current circumstances. After they're done, I will provide some local response and updates to what we're doing at the local level to address various issues, and we hope you'll find this information helpful and informative. So to begin with, I'll ask Win Brown to address the public health and health delivery issues associated with Heywood Hospital. Thank you.
Hello, everyone. Thank you, Jim, for the invitation to come talk to everyone in the community today and give you an update on what's going on at Heywood. We have been monitoring the situation. The pandemic developed since really the beginning of the year and monitoring its escalation across the globe and obviously its arrival here in the United States. And so we've done things like we've been preparing, making sure we have enough supplies on hand, although that is a challenge today because everybody is looking for the exact same supplies that are available because many of the supplies, especially the personal protective equipment, is actually manufactured in China, and so that has put a crunch on health systems across the United States. And so we've made a number of changes into how we deliver care in our region, some of it more virtually via telemedicine. We have consolidated practices and done a lot of things in the community to make sure that we can continue to provide care. So right now, Heywood Healthcare operates in what's called Incident Command, which is really a military format, so making sure that we have all parts of our organization functioning well. Both hospitals are fully operational right now. Both of our urgent cares, the urgent care in Gardner and the walk-in care at telemedicine, are both open. And those two urgent cares are very important to the community because they provide the access for walk-in COVID-19 testing. So if you have flu-like symptoms, instead of going to your physician office or coming to the ER, if you are well enough to come to urgent care, you can be screened by a physician or advanced practice provider there. Have your flu swab done if that's appropriate, get an x-ray, potentially you have pneumonia, that might be one of the situations you're dealing with, and also we can provide COVID-19 training there. We have tents outside both of those facilities so that we can provide that testing out of doors. And so we're seeing an increased turnaround time, an improvement in turnaround time for those tests. Originally, they were taking upwards of 5 days to get back, and now we're in the 24 to 36 hour zone for that. So I would encourage anybody who has flu-like symptoms that they cannot manage at home on their own, that they can go to one of those two centers and get tested. Obviously, our ERs are available to you as well if you're more acute. The first line of defense really is to call your primary care physician, and I know Dr. Michelle Parker was on this last session with Jim talking about what is going on, and you should really call your primary care physician. All our offices are taking calls and scheduling appointments, and you can actually see your appointment. You can go in and have an appointment with our physicians if you are well. Perhaps it's your annual physical or a checkup. We still provide those services. That's why we are having patients who are not feeling well go to the two urgent cares to keep our practices operating and providing access. Some of the things that we're working on right now at Heywood are capacity planning to make sure that should we have a surge in patients on the inpatient side, how are we going to manage that care? Supporting our staff who are working tremendously hard. If you see my daily updates that come out, we have an increased inpatient census at Heywood in particular for positive patients and that patients that were waiting for their tests to come back to know whether or not they rule in or rule out for COVID-19. And so we've done a lot of training, obviously making sure that our staff are supported in the work that they're doing. So what would I suggest? It's really the common sense that you hear. Please stay home. Do not go out and about in the community. If we do not do anything to lower the inflection point of this pandemic, all the health systems will be really overwhelmed. And what we really need to do is flatten the curve of the pandemic so that we can handle and take care of our community as best we can. And right now we're in a very good situation. And if we can keep everybody home and out of traffic, just going to the supermarket or to the drugstore when you need to, washing your hands, great hygiene is incredibly important. This is a very contagious virus, and as you've learned on the news, it's a novel virus, so none of us have any antibodies built up to it, and so we really need to stay home. I know it's a huge hardship. There are a lot of businesses that are closed in our community, and a lot of you have children home that are usually in school, and so this is not business as usual, but it is our new normal for the foreseeable future. And so I just encourage everybody to play their part and do their role. We work very hard to keep everybody updated on what's going on and trying to be very transparent as your healthcare providers. So you can go on our website. As I mentioned earlier, my videos are up that I do twice a day are there. Any new news for the community is there as well. And so I encourage you to access that way. And obviously, if you have a call, you can call in or email with questions that you have as well. And we'll do our best to get back to you as soon as possible. I do want to thank all the staff and all the providers at Heywood Healthcare who are doing an exceptional job. You should be very proud of the work that we are doing in the community and that our staff are doing to take care of everyone and keep everybody close to home. And we appreciate, there's a lot of hand-sewn masks coming in, which are very helpful, which we are using right now with our non-clinical staff, and it will be our backup if our supplies get very low, and we have had some inflection points where they've been low, but we've got some supplies from the state. As you can imagine, it's a challenge these days to get everything done, but we're in pretty good shape at the moment, and I just want to thank everybody on the Heywood team for the great work they're doing. So I think I'll close my remarks there for the moment and invite Representative John Zlotnik up to give an update as well. Thank you very much.
Thank you. And first, I just want to thank Heywood Hospital and Lynn Brown for not only doing a good job through this crisis, but through his daily YouTube addresses, keeping us all updated in this community. So the legislature has been busily working to do what we can do to address this and support Governor Baker in his efforts through executive orders to keep us safe and make sure that we get through this all right. The governor has requested and the legislature has approved additional expenditures to beef up the state's testing capability in lab through additional staffing and supplies. One of the first things we heard as this crisis started to hit from our local providers was that testing needed to be ramped up and the availability of that needed to be increased dramatically and quickly. And we've taken steps and are continuing to take steps to make sure that our testing capability is adequate for the situation. The governor requested and the legislature approved a $15 million expenditure to beef up local boards of health and their capabilities to monitor, track, and contain, and also promote public awareness and prevention efforts around COVID-19. Importantly, as many businesses are being temporarily closed and people are being laid off or otherwise put out of work, the legislature has approved a waiver of the 1 week wait week for unemployment insurance. Typically, when you apply for an unemployment insurance benefits through the state, there is a 1 week waiting period before those benefits can be considered. Temporarily for this crisis, that week has been waived. Affecting Gardner more specifically than some other communities perhaps, the legislature has granted local cities and towns the authority to move municipal elections like our local special mayoral election that was or is still scheduled, I guess, to come up while the council considers moving that. So elections previously scheduled for May 30th or earlier, the legislature has authorized those to be pushed out up to the end of June 30th. The legislature is also considering taking additional steps around municipal governance. The first is focusing on challenges dealing with municipal finances to make sure that municipalities have the flexibility and the capability to address and meet all of their obligations, with a lot of things being in flux financially right now, and make sure that state rules around municipal finances are not impeding a municipal's ability to either, one, meet their obligations, their normal obligations, or also do what needs to be done to meet the challenges of the COVID-19 pandemic. The legislature is also has legislation pending concerning first responders to make sure that first responders who may either contract COVID-19 or need to be quarantined for those related reasons, that those be automatically considered on-duty related illness, and not negatively impact them as a result of them continuing to do their essential work as we move through this crisis. I'd also recommend that people watch Governor Baker's daily addresses, press conferences that usually take place in the middle of the afternoon, where the latest and most up-to-date information as COVID-19 concerns Massachusetts will be delivered there, as well as any changes to the governor's various orders as they pertain to this situation as well. The other thing I'll stress is to stay in good communication with your local officials, with your healthcare officials, and also with your state officials like myself, so that we know as best as we can how this is impacting you, your business, and the community at large, so that we can continue to make the legal changes necessary to make sure that we weather this storm as best that we can. And as a reminder, you can contact my district office for any of those needs or any other concerns or assistance that you might require at 978-410-9559. Again, the district office phone number for Representative Zlotnik is 978-410-9559. And with that, I will invite Acting Mayor Jim Walsh up to give us an update from the city side.
Thank you, John. I wanted to give an update, a reminder of some things, and a news about some other things that are affecting people at the local level as it relates to the operation of city government. City Hall remains closed to the public, but all the departments remain operational and can be accessed for their services by telephone, by accessing the main number for City Hall, which is 978-632-1900. Departments can also be accessed by email, by online access, and by leaving communications, written communications, at the drop box that is located at the outside the main entrance to City Hall. Among the items that are now excluded from the governor's advisory regarding non-essential and essential services, construction projects here in the city are considered essential, so they do continue. However, protocols have been promulgated by the Department of Public Health that apply to the people who are involved in those construction projects in order to keep them and the public safe. So projects are continuing. The building department remains open for business. The permits can be applied for and processed through our online portal. And the building department, led by Roland Jean, has devised a method for conducting inspections associated with projects by real-time video monitoring. So we've responded to the need for making sure that these projects are done in a safe way by making the inspections that are required for building, for electrical, for plumbing, to be done through real-time video. The police departments and fire departments are fully operational and responding to needs as they arise. However, I should point out that the fire department headquarters is currently closed to the public. Another significant concern that people have for their activities is the golf course, our municipal golf course here in Gardner. The Massachusetts Emergency Management Agency has determined that golf operations are non-essential. As a result, the golf operations are closed. Now, we have snow on the ground, and that's not really an issue today, but they're closed until at least April 7th, so that may be an issue that affects people at least until then. Golf maintenance operations can be maintained by special approval of the local Board of Health, and to get that, the golf people will need to supply the Board of Health and me as acting mayor with a plan for maintaining those, for operating maintenance in a way that meets the protocols of safety that have been promulgated by the Department of Public Health and overseen by the local Board of Health. So more on that as time goes along. Hopefully we can open for business as soon as possible after April 7th, but that remains to be seen. Schools, as the governor announced yesterday, have been further closed for until at least, well, hopefully it's a firm date of May 4th, and so children will not have the opportunity for in-building school instruction until at least May 4th, although the school department is doing an excellent job, led by Superintendent Pellegrini, to set up opportunities for online and alternative course materials. I want to remind people that the public parks and playgrounds remain open. However, the equipment may not be used. Use is prohibited because there's no way for us to ensure that the equipment can be sanitized in a proper way. So signs are out at all of the public parks and playgrounds notifying everybody, so we urge people to comply with that safety announcement in order to ensure that we do our best to minimize the potential risk of contraction or spread of the virus. One particularly somewhat new matter that Representative Zlotnik alluded to in his remarks is that earlier this week the legislature passed and the governor signed provisions that authorize local communities to postpone and reschedule local elections, and that includes special elections. As I'm sure all of you know, we have two special election dates that are currently scheduled, a preliminary on April 7th and a final on May 5th, to fill the vacancy of mayor occasioned by the resignation of former Mayor Mark Hawk on January 21st. I can tell you that this legislation requires certain action by the city council, the city clerk as the local election official, and me as acting mayor as chief operating officer of the city at the present time, to meet and to confer about logistics and feasibility for rescheduling of the election. I have scheduled, in my capacity as council president, a meeting of the city council for Monday. We will meet this coming Monday, where we will meet informally to discuss those logistics and feasibility with the clerk. We will be meeting remotely. People will be calling in to participate in that meeting. It will be broadcast here on WGET. I hope Tim Josty knows that, but he does now. We will consider the prospect of postponing those dates to new dates, and whether it makes sense and can be done at later dates. We want to do it. I can tell you that the new dates have to be on or before June 30th, because that's the end of our fiscal year, and any new mayor will certainly want to have as much opportunity as possible to be in place and to make decisions associated with new budgets and other matters that have to be addressed in a timely manner. So we will be doing that on Monday, and there'll be more on that to come next week. I want to encourage people to visit our website at gardner-ma.gov to the COVID-19 page on that site. It is updated regularly with new information, updates on the current situation, both as it relates to local government as well as other aspects of our response to this pandemic. Also, I encourage, as Win Brown did, that you visit the Heywood website, which is at heywood.org, and the COVID-19 page and updates that are available there, as well as the twice-a-day YouTube updates that Win has been providing for a few weeks now. And they're very valuable to get the current status of our response to the public health emergency that we are currently living in. The Department of Public Health at mass.gov has valuable information that you can access at any time. And the Center for Disease Control, of course, is at the national level the best source of information for our current response at the national level to the pandemic crisis that we're in. That concludes the updates for today. I want to thank Win Brown and John Zlotnik for providing their input into this update. There'll be more to come next week, I expect. But thank you for your attention, and be smart, be safe. Thank you.